Hello, this is Sudharshan, and in this episode, PH 1.30, we'll see part 2, that is the class 2 antiarrhythmics beta blockers. So here, with respect to the beta blockers, we have the selective beta 1 or the cardioselective beta 1 blockers and the non-selective beta blockers. So coming to the cardioselective or the beta 1 blockers, we have the atenolol, esmolol, S-butalol, metoprolol and bisoprolol all have the olol suffix, and S-butalol is another drug. And with the non-selective beta blockers, propranolol, timolol, nadolol, pindolol, sotalol, and in the non-selective beta blockers we have those with additional alpha 1 activity like labetalol, carvedilol and bitaxolol. And as the mechanism of action is, it will depress the heart, and that will lead to conditions like hypotension, dizziness, bronchospasm, and it is used to treat different heart conditions like arrhythmias, tachyarrhythmias, bradyarrhythmias, ventricular arrhythmias, paroxysmal supraventricular tachycardias, atrial fibrillation, etc. And these drugs can also cause torsade de pointes as well. And with the drug interactions, these drugs interact with calcium channel blockers and also with nitrates. And the treatment for the potentiation of effects of beta blockers, or whenever there is a poisoning, that is saline, atropine and glucagon, these are the antidotes, and these drugs are contraindicated in pheochromocytoma and cocaine toxicity. Pheochromocytoma is especially important because of additional alpha 1 blockade. And another important point, that is sotalol. Sotalol, apart from being a class 2 antiarrhythmic, is also a class 3 antiarrhythmic. So that was all about the class 2 drugs. So thank you so much. We'll see you in the next lesson.